Hey everyone, it's Coach Kathy here, and I've lost 150 pounds and I'm here to help you meet your weight loss goals and more importantly, maintain them. But today I want to talk about something about my own personal journey, and it's because I have been getting so many inboxes. Like I have fielded and received dozens and dozens and dozens of questions about my recent plastic surgery journey. And that's probably because I've shared a few pictures and I've shared a few videos, and I understand you all have questions, so I'm here to answer them for you today. We're going to do a who, what, why, where, and when of my plastic surgery journey. And so, let's just get right to it. The who is Dr. Andrew Mulheron. So he is out of St. John, New Brunswick, though I did, for the where, have my surgery in Sussex, New Brunswick. And when you are a patient of Dr. Mulheron's, and if it is going to be a day surgery procedure, sometimes you are given the option to have your surgery either in Sussex, New Brunswick, or in St. John, New Brunswick. So for those of you, who are not local and who don't know who I am, or anything like that, I do live here in New Brunswick, Canada. And so after losing 150 pounds, it came with some side effects, and that included a lot of loose skin. So I recently had, here's for our what, the FDL panniculectomy, and the FDL stands for fleur-de-lis. And I recently just learned the reason why it's called fleur-de-lis is because the shape of the skin that they remove off of you during surgery, once it's laid out, it actually makes a pretty similar shape to a fleur-de-lis, if you're familiar with that. And I will link at the end of this video, that very grody picture. If you are squeamish, don't look. It is interesting, and it's crazy to know that that was just on me 9 days ago. I am 9 days post-op. So yes, that procedure is skin removal only. The panniculectomy is the removal, the ectomy of the pannus. And the pannus is that apron belly. It's that lower, sometimes it's called a fupa, but it's that lower roll, if you will, the section between the groin area and the belly button. And that's for a man or a woman. There's lots of men who have panniculectomies as well. So this is not considered a procedure always to be cosmetic, though I do look substantially better since having it. Cosmetics and looks were not the main factor in driving this. And so I guess that leads us to the number one question I keep getting on my inboxes and in these groups, and that is, did your insurance cover it? So because I am in New Brunswick, if you're not from New Brunswick and you're not from Canada, we do have universal health care here, and it will cover some procedures like this, and mine was covered under our New Brunswick provincial health care called Medicare. Now that's not always going to be the case for everyone. There are certain requirements that Medicare has, but the question I keep getting is, Kathy, what did you do to get this covered under Medicare? Okay, well, I didn't do anything but lose 150 pounds. There's no secret sauce on how to get this covered, and I'm sure this goes for those of you in the States too. They're trying to do this through a private insurance. Really, it's an individual thing, and it comes down to what your goal weight is, how long you've maintained it, if you have maintained it, your body shape and size, any underlying medical conditions, what your surgeon that you have is even willing to do. Not all surgeons are going to go to bat for you for this. And oftentimes things they don't go to bat for you because they know things are out of their hands. And also what realistic expectations are. So no, this was not a tummy tuck, aka abdominoplasty. I'm not a doctor, I don't play one on TV, and I'm not going to pretend to know all the ins and outs of plastic surgery. But the difference between these two procedures, which is also another very commonly asked question, is this was just skin removal. All my surgeon did was go in, remove 7 pounds of skin in the shape of a fleur-de-lis, rerouted my belly button, and sewed me back up. There was no liposuction. There was no muscle repair. I did not have diastasis recti. All of those things make for a fabulous procedure with fabulous results, but they weren't appropriate for me for a number of reasons. And they are considered cosmetic and most likely will not be covered under most private healthcare insurance, and it's definitely not going to be covered under New Brunswick Medicare. Now, and like I said, it's a fabulous procedure, and it is life-changing for many people, just like my procedure was life-changing for me. But I've had a DVT, which is deep vein thrombosis, aka a blood clot, that flicked off and a piece landed in each lung. So I had what was called a bilateral pulmonary embolism. I had this after having my right kidney removed when I was 22 years old and almost 6 months pregnant. So yes, pregnancy, surgery, malignancy, those are all risk factors for blood clots. And I don't have a family history of blood clots, and I don't have a blood clotting disorder. But because this happened post-operatively previously, that means any future surgery for me is very risky. And the longer that you're under in anesthesia, and what you have to do post-op too, if you're limited with mobility and if you have to wear compression garments, like all of those things increase risk factors. So even if I was a good candidate for a tummy tuck for other reasons, I wouldn't have been simply because of my blood clot risk. However, I don't have diastasis recti, and I didn't even have enough abdominal fat left to be liposuctioned, which sounds crazy for me to even say that out loud, because there was a time that there wouldn't have been enough liposuction in North America to take care of what I had. But anyways, so upon my first consultation with Dr. Mulheron, which was over a year ago, I mean, it was actually like 18 months ago, he examined my stomach. And guys, just be prepared when you go into this pre-surgery, your initial consultation. You got to leave all modesty at the door. And it's hard as a woman to have, P.S. he's really cute, a nice looking surgeon kind of like just playing with Play-Doh on your belly, and you have to like lean over a table and just let that abdominal tissue and excess skin just hang, and while he's manipulating it to see what's pliable and if there is diastasis recti and things, and he's gonna have to get in there. And I don't know about any of you, but I was always so self-conscious of that role, that to have anybody else touch it, I mean, you worry about things like body odor and sweat and all of that. You're going to think and be afraid of all the things, but trust me when I tell you, any plastic surgeon has seen and touched and smelled all the things. So don't worry about that, but just, be prepared going into that's going to be a little bit of a weird appointment. But anyways, upon his manipulation and everything, he determined that I was an excellent candidate for a panniculectomy. And we actually didn't even talk about the fleur-de-lis cut the very first time. Now, fast forward a year, I'd already signed the papers and everything. I got the Medicare approval. And sidebar too, I do have multiple sclerosis. I am on a very, very powerful immunosuppressive drug. It wipes out more than half of my immune system. And that means that I don't respond well to infection of any kind. Like it takes me longer to heal from a hangnail, and respiratory infections. And, different infections can be more life-threatening to me than they can be for you if you have a fully intact immune system. And that includes fighting off, and for whatever reason, people with MS have great difficulty fighting off skin infections in particular. And so when that underneath the roll, like it's a hot, wet, moist, friction-heavy environment, and that makes for rashes, that makes for yeast infections, that can turn, for someone like me, into something called necrotizing fasciitis, which is also called flesh-eating disease. If you've watched Grey's Anatomy at all, you've seen that show up a couple of times. But anyways, it was a legit health concern for me. And no doubt when Medicare looked at all the information put forth by Dr. Mulheron, that may have been a deciding factor for them. Because I've heard from so many people like, how did you get it covered? How did you get it covered? Again, I didn't do anything. He took pictures, he took my medical history, and he presented all of that to Medicare. They make the decision. But was my MS a factor of it? It might have been. I don't know. I do know lots of people in New Brunswick who have had panniculectomies covered through Medicare and didn't have MS. So it's not the only factor, but was it a factor? Maybe. So anyways, it took about a year before some OR time opened up again. And again, things were kind of backlogged here in Canada and in New Brunswick in particular. So when it was time to see him again, I'd actually lost another 35 or 40 pounds. And had maintained that for 6 months. So like the first 6 months after not seeing him, I had lost it and then maintained it. So I was at a very stable weight. It was below what my goal weight was from my bariatric surgeon, who never really gave one. He gave like an ish number. It was like around 180. And so when I went to see him, I was maintaining steadily 135 pounds and had been for 6 months, between like 132 and 135. And so that extra weight I lost from my initial consultation with him to the time I saw him, just a couple of months ago, that changed things. And I did ask about the fleur-de-lis cut, and I carried as much extra skin, and it was like folding in on itself, almost like a bum, and it would rub and chafe this way as well as the lower part. And it really, the more I lost, the more it came inward, and the more you could really see that it was more skin than fat now. Sometimes people have equal amounts of fat and skin. And, like I said, I was not required to be like a certain BMI or a certain weight or anything. It was just that my weight was stable and it was at or below my bariatric surgeon's original goal weight for me. And I do get asked that a lot too, like, what did your BMI need to be? Well, there was not that requirement. But anyways, so I was skirting around like a 19.5, 20 BMI stably. And that meant that there was very little body fat left. And I had skin that was like getting pinched in zippers. And it was, even feeling heavy underneath my breast and with breathing. But most importantly, it was folding in and rubbing and chafing this way. And so when he made that cut, that was, oh, Rusty's going to say hi during our little video today. Anyways, when he made that, by removing that skin, that was also eliminating that very detrimental to my health skin rubbing and chafing. And time is a factor too. OR time's absolutely a factor. And that's something he has to factor in. And he made no bones about that right at the very beginning. He's given a set amount of time, and short of catastrophe happening in the OR at that moment, he can only do what he can do during that amount of time. So for somebody who would want to have this procedure done, like the FDL cut, the fleur-de-lis cut, and the panniculectomy, and they still have an excess of 50 pounds, and even if they've met their goal weight and maintained it, but they still have a lot of abdominal fat, it's probably not going to happen. And I'm not saying like, don't talk to your family doctor about this, don't talk to him about this, this is always going to be a no for you. That's not what I'm saying. But I am saying that my case probably wasn't typical. My weight loss results, even from having sleeve, is a bit atypical. Most people don't lose as much as I lost. Most people definitely don't maintain it. And, most people don't get down to that lower body fat level. Like I'm hitting like 22% body fat right now. And so I'm almost at I'm at fitness level, but not athlete level. But anyways, that too will be a factor. So because I had lost and maintained and had such a low body weight, that provided him the opportunity to have the time to do the FDL cut. And that was a major, major, major factor. So again, I'm not saying it won't happen for you, and I'm not saying you shouldn't ask about it, but I'm just saying if you ask about it and you get told no by your plastic surgeon, because there's many out there, that could be a reason why. And I still encourage you to inquire all of it, and I still encourage abdominoplasty. I mean, I realize times are tight and the economy is difficult and things seem kind of unsteady right now, but it really, really does. My results with just a panniculectomy would not be what they are having had the fleur-de-lis upper portion cut. And he actually said, and you'll see it in the picture, what he removed up above was more than what was left down below on the pannus. So everybody's different. Everybody's situation is different. Everybody's medical history is different. Everybody's surgeon is different. Everybody's surgeon's requirements are different. So this really, really will always be a case-by-case basis. And it doesn't mean you're a failure. It doesn't mean you're too fat. It doesn't mean like you did stuff wrong. If you go inquire about the same surgery I had and say, I saw Kathy Richardson on YouTube and, you cut this off of her. Why can't you do that to me? Just know there's so many factors that go into it. So with that, I've been asked too, am I going to have future surgeries? Well, hey, reality is I might have these degrees here and whatever, but I'm not a millionaire. I've not made $1 from coaching yet. And it's the health risk thing too. Like as nice as it is to have that flat tummy now and the smaller waist, I don't have the health risk anymore from that skin. And that's what's most important. And so any future surgery for me, I've got to weigh the pros and cons. Like, is this worth the money and the health risk, or is it worth just living with? Because I mean, the reality is, guys, I'm 45 years old. I'm not trying to be a bikini model or win any beauty contests or anything. I'm just trying to stay alive and live my best life. And for some of you, if having plastics and going all the way means you are living your best life, then go for it. You do you. I will never judge anybody who chooses that route. But as for me, you know, I would love to get rid of the loose skin you have here. And I could go right down through my body and pick apart all things that have changed upon losing 150 pounds. I always joke and say my inner thighs look like a shaved scrotum glued to my inner thigh. You know, it'd be great to have that lifted and whatever. But it's not a health risk. And to me, it's not worth risking my health via future blood clots to have that done. But I am left with a breast situation. So I was also at the same time pre-approved through New Brunswick Medicare to have a breast reduction. And they have requirements going into that. And so I started this journey as a G cup. I was a 44G. My bra today, right in front of you right now, is a 34D. But it's a lot of skin, but there is still some volume. And because there is a lot of skin, I still have that same chafing, sweating, rash, you know, that situation. Although it's gotten a little better, the smaller they've gotten, that loose skin is all there, and that still needs to be taken care of. And there is a minimum 200 gram per breast removal requirement. And so that's actually not going to leave me with a lot left. And so that was a conversation I had to have with myself and with my surgeon, and just think, you know, will I genuinely be okay the rest of my life, maybe going down to an A cup when I've been a G cup for so long. But the reality is, I'd rather be an A cup and alive than a D cup, you know, with what I have left, and die of necrotizing fasciitis because I was too scared or too vain to not deal with the health risk that extra skin is always going to have until it's rectified. And so I actually have chosen to go ahead with the reduction, knowing full well it's not going to leave me much left. I mean, implants are always an option down the road, and there is a procedure where they can take your skin and tissue and they sort of tuck it in and make a new breast out of it. That would be considered cosmetic. That would not be covered under Medicare. That's a conversation my husband and I have to have. But if nothing else, I have signed the papers and agreed to have the reduction, just so that I can put to bed that last spot on my body that has, you know, the opportunity to be lethal for me via a skin infection. So that's not going to have before and after pictures. I don't mind doing in bra pictures and blurring things out, but, you know, I don't mind sharing my stomach, but, you know, a little bit of modesty here, guys. So that's where we're at right now. That's who did it, where I had it done, why it may be an option for you, and why it may not be an option for you. And so just know that this is a tough journey. It's not an easy one. You will be judged for it. You know, I've been judged even since before I had my vertical sleeve surgery, and that's a conversation for another day. But I remember people were like, just, oh, she's having a tummy tuck. And, you know, no, not, I still didn't even now. And you know, but you just need to leave all that behind. And this is a conversation for you and your surgeon to deem what is best and to have realistic outcomes. That's so important too. So many people think they are going to go have just a panniculectomy and they're going to come out looking like a bikini model. Well, maybe you will. Some people do, but most people don't. So I encourage joining Facebook groups that talk about plastics, especially plastics after weight loss surgery. I'm a member of a few of those, and they are excellent, and I've learned so much from them. And talk to other people who've had this procedure, and talk to your surgeon and see what's right for you. And if you have any questions about my journey and about plastic surgery and my experience with it, shoot them in the comments down below. If you like videos like this and you want to see more content like this, I sure hope you stick around and hit that subscribe button. And that's it for now. We'll talk to you later. Bye.